Good afternoon. This is Aisha Salman, ASA's Business Intelligence Analyst here. Based on great demand from our members, we have decided to hold another series of webinars with our Chief Economist, Dr. Chris Kuehl. Dr. Kuehl previously did 3 COVID-19 economic impact webinars for us, and based on that previously mentioned great feedback, he is back to conduct 2 more. The last one will take place May 13th, 1 p.m. Central. And of course, Dr. Kuehl will also be front and center at ASA's Network 2020 event in Chicago in October, presenting the 2021 economic forecast. In today's webinar titled, When Will We Peak? What Does It Mean? Dr. Kuehl will shed light on what it means by ending the lockdown. What will the trade-offs be when we have to balance the disease with dealing with a frail economy? Almost 60,000 deaths in the U.S. alone, and the GDP has fallen by 4.8%. Dr. Kuehl has a doctorate in political economics and advanced degrees in Soviet and Asian studies, and is also a co-founder of Armada Corporate Intelligence. In addition to being our chief economist, he is also chief economist at a few other associations, and an editor of the Business Intelligence Brief, and a primary writer for the Black Owl Report. The webinar, as before, will last 40 to 45 minutes, and we will open the floor to questions and answers at the end. Please post your answers in the question box on the GoToWebinar window towards the bottom. We will try to get to as many questions as possible today. Over to you, Chris.
Very good. Thank you. After these introductions, one always has to think for a second. You know, here I am, this economist, and I'm representing all these. You would think that I would know what the heck's going on, but every day I feel more and more like a meteorologist who gets all the data and all the models from the U.S. and Europe, and then somebody asks him, is it going to rain tomorrow? And he just kind of looks at me and shrugs his shoulders and says, I have no idea. Let me look outside. It's been crazy, and a good example of how crazy is the GDP numbers. As Aisha just mentioned, we have a GDP decline in the first quarter of over 4%. What was interesting was looking at all the predictions that were coming out earlier this week and the end of last week. There were economists who were predicting that we would be down 14%. There was an economist that said we're going to be down 28%. There were people who were saying, oh, we're not going to go down at all. We probably had growth of 1%. Really? We were that far off in some cases. Granted, there were an awful lot of economists that thought we were going to be around that 4-5%. So there were those of us who had some sense. My own personal prediction had been about 5.1%, so I was a little bit more pessimistic than justified, but not by much. This is unprecedented. We've said that a million times, and we'll continue to say that until we're kind of out of the mess. So as we go marching forward, let's see if I can get my slides to move here for me. So far they're not. So if somebody could help me, this is a really exciting first slide, but there's much more of interest there, and I don't have control. So I can just keep on talking, but it would be nice if I could see my next slide. So could somebody actually give me control?
Jan, can you just move the slide or give him control, please? Hang on.
Okay. There we go.
Okay.
I think we just moved.
Great.
All right. So I'm not sure who
Great.
did that. Somebody else. Anyway, we've been sort of playing with this Black Swan theme from the very beginning. And so now, hopefully, the Black Swan is becoming outnumbered by the normal white swans. And we'll see that play out in May. We'll see how that proceeds. From the very beginning, this has been a trade-off issue, and that is what's made this just as tricky as it can possibly be. We're not dealing with an issue that has an obvious solution, because anything we do to deal with the medical side of things is going to make the economic side of things worse. anything we do to deal with the economic side of things is going to make the medical system worse. We've been left with a very awkward response to COVID-19 because we weren't in a position to do anything else. If we had been able to test early, if we had a test we could rely on, and it was widely distributed, we would approach this very differently. We would have found out who had the disease, we would have dealt with that, everyone else would go about their business, but we didn't. If we had effective treatments from the very beginning, dealing with this differently, but we haven't. We've not been able to really deal with people who have severe cases of COVID-19, which is why the fatality rate has been what it is. If we could have traced where people were, lots and lots of ifs, but none of those were available. We really had just one thing, and that was trying to keep people away from each other. The only way to do that is to essentially shut down the world economy. So now we've reached a point where we have to shift focus to one degree or another, and we have to decide how much of the damage we could take from both the medical and economic point of view. One of the things we've been examining is the pandemic peak. We now have reached peak in most of the United States and really are about a week or two past it in most states, which means that we've reached a point where the number of new cases has diminished, the number of fatalities has diminished. We're kind of getting on top of the actual outbreak of COVID-19 disease. The next thing we're going to be looking at is when states begin to open. And this is going to be a little trickier because it's not necessarily based on any sort of observable science. It's not like we can make some kind of calculation like we've been able to do with the spread of the pandemic. This is going to be dependent on the decisions of 50 state governors. They're all going to have their own criteria. They're all going to have their own pressures. As you can tell, even by this outline, Georgia was expected to be one of the last states to open up. And this was based strictly on the exposure they had to COVID-19. It was based on the fact that Atlanta was a large urban area with a significant number of cases, that it was a state that was going to struggle to be able to control what was going on in some of the more rural areas. Well, the reality is Governor Brian Kemp said, nope, I'm not going to wait to the end of May. I'm not going to wait till the beginning of May. I'm going to open up in April. Georgia all of a sudden became what amounted to a guinea pig. It's going to be a state that everyone's going to watch and say, look, if your decision to open up early results in a rate of secondary infection that is horrendous, then we will determine that that was a really dumb thing to do. If, on the other hand, you opened up early and nothing really happened, and the fatality rate didn't change, and the hospitalization didn't really change, then it's going to encourage all the other states to say, well, why am I waiting until the end? I'm going to open up now. Apparently, it's safe and appropriate time to do it. So we're going to be watching every state that opens like a hawk and trying to determine if there is a technique that is more effective in some circumstances than another. This is fairly accurate numbers. There have been some changes since I put this together. We're probably around 3 million cases worldwide now, probably around 200,000 deaths worldwide. The statistic that really hasn't changed much, and maybe the more important, is that 96% of cases judged to be minor. Minor is a relative term. It basically means that people are not hospitalized. They may be very sick. It may be the worst that they've felt in decades, but they're not being hospitalized. They're not dying. Part of the challenge, and I've mentioned this several times before, is that COVID-19, for about 50% of the people who get it, have no symptoms. It's asymptomatic. So people are running around with the disease and have no idea they have it, no idea that they're spreading it because they don't have any of the symptoms. And that's part of why the containment thing has become the only real option. Because if we knew that people had it, you think about the flu, which early on people were comparing to COVID-19. The flu, within literally hours. I mean, no one in the world has walked around with the flu for 2 weeks unaware they have the flu. You know right away, and it's easier to isolate people when they know they're sick. If you don't know you're sick, hard to isolate. The U.S. statistics were up around 50,000 now. The deaths per million hasn't changed a whole lot. We're about 150 deaths per million. In comparison, places like Spain, Italy have been hit much harder. We are now up around 17,000 tests per million. Germany is around 30,000, so they're still kind of ahead of us when it comes to testing. And oh, by the way, if you want to go to the most tested country on the planet, the one where the numbers are close to 100,000 tests per million, it would be Iceland. Moral of the story is, if you want to be safe from COVID-19, move to a volcanic island in the middle of the North Sea with a population of around 50,000 people. You do have to listen to a lot of Bjork, but other than that, it's a great place to survive. It's also a country that drinks a lot. That may have something to do with survival. At least it should. We have around 25 million people out of work, and as I've talked before, the critical thing here is whether they are truly laid off or if they are more in the category of furloughed. It's more than a semantic difference. The furloughed worker is somebody who has essentially been told, when we come back, so do you. So if you're running a hotel, you're running a manufacturing facility, you're running anything, and you've been forced to shut down, when you come back, you have to have workers. You have to have your employees back. And many companies basically indicated to their staff, the very second that we can bring you back, we will. We have to. And then it becomes a matter of, can you get that workforce back, and will they be willing to resume their careers? A lot of concern was expressed early about people who would prefer to stay on unemployment, get the benefits that are being given by the government, and not go back to work right away. And there will be a percentage of workers who will do exactly that. We've referred to them for years as transactional workers. These are the people who have never treated their job as anything other than a paycheck. I mean, this is the population that has the highest turnover of any of your businesses because, if somebody across the street offers them 25 cents more a month, they'll give you. I mean, it's kind of like, man, this isn't a career. I've got no future here. I'm just looking for the paycheck. I get paid every day, every week, whatever it is. And there's not a great deal of commitment either way. Any of your workers that look at their job and say, I'm here for the paycheck, but I also think if I stick around, I'm going to get promoted. I'm going to get a raise. I'm going to get benefits. I'm going to get training. I'm going to get skill development. Those are the ones who are sticky, and they don't really compare their job with getting money from the government. They know that the government money runs out in July or August, and they'll come back to work. The trajectories that we've seen in the rest of the world are trending the way we hoped they would, and at about the pace we thought they would. So China, very definitely seeing the bell curve, seeing that in other Asian countries. Now we're starting to see it in Europe as well. I've mentioned this before, but just to reiterate, the numbers that we used to get from China, we didn't trust. China was pretty obviously obfuscating. Way last year, 2019, the outbreak in Wuhan was not even reported to the Beijing authorities for months. And then after that, Beijing was being pretty, shall we say, frugal with truth. Today, China is so overrun with international health authorities that they're no longer the ones collecting the data. The data that's coming out now is predominantly from WHO, CDC, Japanese Health Ministry. I mean, at last count, there was a health agency counting other agencies. There are 123 national health agencies from around the world operating in China. China is the epicenter. China is the guinea pig. Everybody wants to know what's happening there because that means it will happen somewhere else later. Wuhan now reports that there are no patients in their hospitals with COVID-19. They have not reported a new death in 8 weeks. So the assumption is that this disease does have a peak. line, and it's basically predictable. It's coming within a certain number of days and weeks. We still have a lot of difference in terms of exposure within the United States. We have a lot of states that have very moderate exposure. We have states that have very high exposure. Those states that have seen high exposure, higher populations, states that are more oriented towards travel and tourism, areas with a more exposure because of age. You'll see the Southwest has a fairly high exposure. Arizona, even though it's a state that doesn't have huge population centers, but it's a state that has an older population. A lot of it has been down to congestion, and so you end up with states that have higher urban populations. Was having a Zoom conversation webinar last week with a bunch of people who were predominantly East Coast, and they were lamenting, saying, "God, I don't know how we're going to deal with this. I mean, this is, how do we go back to moving around? Because we travel on subways and buses and commuter rail, and somebody says, well, how are you handling it out there in Kansas City?" And I just kind of had to pause for a minute and say, we have a light rail. It goes 10 miles and turns around. We don't have a subway. I think we have 3 buses, maybe 4, and mass transit in Kansas City is more than 3 people in your truck. I mean, it's just, we don't have those concentrations. And as a result, we have not been exposed quite as aggressively as other parts of the country. That's going to be an issue as we open up. States that have less risk are going to be able to open up more aggressively than states that have a higher risk. We don't see lines like this very often. This is the Purchasing Managers Index. Usually it looks like some kind of an EKG. You get ups and downs, and it doesn't drop off the page like somebody fell asleep with it in their hand. The beauty of the PMI is that it's done for about 38 different countries in the world with exactly the same diffusion index. So it's all done by a variety of different institutions. In the United States, we have the Institute for Supply Management, we have IHS Markit, the banks in Asia do this, but they all use the same system, so you can compare. We saw ours drop into the 40s, even high 30s, but China saw it creep right above that 50 line by a hair. It was like 50.1, which is about as close to contraction as you can get, but it's above 50, and anything above 50 is expansion. Anything under 50 is contraction. So we're hoping, again, that China become the leader, that in 2 or 3 weeks we start to see that same recovery that they experienced. Something to bear in mind, and I have kind of alluded to this before, but this was expected to be a recession year anyway. There was a good number of economists that really thought that 2020 would be a recession year, and those who didn't see it in 2020 thought they'd see it in 2021. So even without COVID-19, this was probably going to be a down year. Not nearly as far down as this, obviously, and probably not even into formal recession territory, but this was expected to be a slow year. The business cycle was pointed that way. A lot of the concerns within the manufacturing community was pointed that way. I mean, for all intents and purposes, manufacturing has been in recession for 6 months. I mean, this was happening way back in 2019. As mentioned in the introduction, I'm the economist for fabricated manufacturers. I'm your economist. I'm representing the Industrial Heating Equipment Association, the chemical coaters. All of them were basically running into issues of recession. So now my slides are moving on their own. So apparently someone really liked the PMI slide. So can I get control again? There we go. The business cycle was pointing to a tough year anyway, and we just sort of got the boot that sent us over the cliff. Some other questions that have come up a lot have to do with how this is going to affect the election, and it's hard to tell this far out. What we know about elections are that a good 60%, 50% of the country made up their mind years ago. We know that about 30% of the public is going to vote for Trump no matter what. We know that 30% of the country is going to vote against Trump no matter what. They are locked in. They've been locked in for years. They're not changing in one iota no matter what happens, which ends up putting the burden on the 40% that has not yet made up their mind. And that's really always the way it is. I mean, you always have kind of locked in voters on both sides, and then it comes down to the ones in the middle. They are going to respond according to how they feel when that election comes up. If they are in decent economic shape by November, they are going to basically vote for the incumbent governor, incumbent senators, incumbent president. It's kind of like, hey, I feel good, I'm okay. The people in charge must be responsible for this, so I'm going to keep them. If they are not in good economic shape, then they take the opposite position. I'm going to vote for the opposition because I'm not in good shape, and the powers that be must have been doing something wrong, and I'm going to try somebody else. So we're going to have to watch intensely what the world looks like the latter part of October, early November. Most of the companies have reported that there have been declines. Big surprise. Most of them are seeing something around 10% more decrease in their revenues. No shock there. We have seen the markets impact traditionally. I mean, they went down like a stone and then have since then become quite a bit more volatile, but not getting back up to where they were. But to give you an idea how bizarre the markets have been, just with the oil market, about a week or so ago, there was a quick mention. Trump said something about if an Iranian warship or gunship attacks an American gunship, we're going to destroy them. Like this was new. And the oil markets responded, and it was like, why? This policy has been in place for 250 years. This dates back to the Revolutionary War. If a British warship attacked an American ship, we were going to fight back. Wow, what a shock. If our military is attacked, our military will defend itself. Who knew? And the oil markets acted like this was brand new information, and the price of oil jumped up by 10 or 15 bucks for a day until they all looked at each other and said, well, that was stupid, and they fell back down again. The markets are responding to anything. I mean, earlier today there was an announcement that came out that there is a potential success, one of the treatment options that's being explored, and the markets responded instantly. There's no proof yet that it's going to work. It's not even out of trials yet, but that was enough to make the markets respond. And we're going to be dealing with this for a long time. The very hint or a rumor of something is going to propel the markets. Consumer reaction, kind of an eye chart. Kind of have to look at it in more detail later. The important thing to get out of this is that even though you've got around 70% or more of people concerned about what's going on with the virus, not that many people have changed their daily habits. You've got 75% that are worried about the virus, and 50% have changed their habits. So that tends to suggest that the consumer is really anxious to get back to normal. The polls right now are very uneven, and it's highly regional, and there's not a lot of good national data to work with. But right now it looks like about 25% of the consumers are champing at the bit, will get back into it the minute they have an opportunity to. About 25% are still terrified and are still planning to be doomsday preppers, and they're going to hide behind their 75,000 rolls of toilet paper and wait for something else to happen. And that, again, leaves the middle, that 50%. What are they thinking? Are they going to get back into the game, or are they going to remain cautious? If they do get back, what are they expecting? What do they want companies to do and not do? So we're still in kind of the experimental stage. If you look at priorities, again, no big surprise, people are spending more money on savings. They're trying to buy better food, etc. But I throw this chart up here really to illustrate one little oddity. Look at the chart underneath, the 21% decline in outerwear, jackets, and coats, which is being attributed to COVID-19. Really? I think that the 21% decline in outerwear, jackets, and coats has to do with it is April. This is the time of year when things warm up. People are not so interested in outerwear, jackets, and coats. So I went back and looked, and every single April, going back at least 20 years, which is how far back I looked, there's been a 20% decline in the purchase of outerwear, jackets, and coats. It's the weather. It has nothing to do with COVID-19. The cautionary note that this reminds me of is that statistics are being thrown out that have almost nothing to do with the current situation. When I used to teach statistics, I used a little book called How to Lie with Statistics because I wanted my students to understand that one, if you learn how to manipulate statistics, you can convince anybody of anything. And two, if you don't want to be dishonest and fool people, you can at least tell when somebody is lying to you and start to look at these statistics and say, now, wait a minute, that doesn't make sense. And this is classic. It's like, yes, COVID-19 was responsible for the weather warming up in April. We've got lots of different reactions to brand messages. Everyone now is trying to position in response to COVID-19. So far, the consumer is expecting a certain amount of sympathy from the brands they want to trust, but there also is a patience level. There's now beginning to be a little bit of resistance to companies that really have nothing to do with COVID-19, but are like, we're really concerned about you here as we're trying to sell you a truck. Well, okay, how does that play into the medical issue, or are you just trying to jump on the bandwagon? So we're going to have a little bit of consumer pushback in the not terribly distant future. Fear factor. Lots of people are worried about COVID-19. Lots of people think they understand COVID-19 when in fact they probably don't. The Germans, when they began to call for people to wear masks, were careful to issue instructions on how to wear masks and what they were supposed to do. We did not do that here, so you end up with a lot of kind of bizarre mask behavior. The idea of wearing a mask is to keep you from giving COVID-19 to somebody else, because it captures your cough and your sneeze. It doesn't protect you from being infected by somebody else because it's a contact virus. If it gets on your hands, if it gets on your clothes, and you touch it, you're going to get contact with it. And doctors point out that one of the more common ways for people to get a virus of any kind is through their eyes. It's a moist environment, it's wet, we use our eyes constantly. We can sort of avoid our mouths and nose, we can use Kleenex, whatever. It's hard to keep your eyes from being exposed. And if you wear a mask over your eyes, you have other problems to deal with beyond COVID-19. The Chinese consumer is coming back to life, which is encouraging because they're not as aggressive a consumer as we are. We tend to be more confident in general, tend to be bigger spenders in general, and if we're going to come back to life, that's crucial for the business community. Asian consumers tend to be more frugal. They tend to be more savings oriented. They tend to respond to crises by withdrawing more than we do. So if the Chinese are seeing a pretty good recovery rate for consumers, it's a good sign for Europeans and for Americans who tend to be more aggressive. I've not seen a huge change in how people shop, except for things like groceries. There's been a tremendous increase in online shopping for groceries. Electronics, not so much. Clothing, not so much. Even takeaway, fast food, not so much. I mean, we're about where we have been before. There has been more people who are stopping completely when it comes to food, as one would expect, because they're ordering more for home. We know what sectors are going to get hit hardest in terms of employment. The 2008-2009 recession hit the high wage earner a lot harder than this one has. That was a financial sector crisis, so you saw a lot of people in the banking sector, financial sector. I mean, you lost Bear Stearns and Lehman Brothers and Washington Mutual and Merrill Lynch. They all went down the tubes, and as a result, the carnage in the terms of employment was severe. This time, it's been retail and service and hospitality and leisure and travel, which tend to have some of the lower wage paying jobs. Overall impact on sales, again, fairly significant, more so for manufacturers than for the service sector, but the manufacturers may be the ones that recover a little more quickly. They're going to be a little easier task as far as reopening. Their trick is going to be making sure that they get the required workforce that they need and be cognizant of what the upstream demand for their product might be. A lot of impact within the airline industry for obvious reasons, but this illustrates also a problem with non-adaptable rules and regulations. Many industries just simply shut down and they save money because, well, they're not paying anybody and they're not buying inventory and they're not operating, so they may not be making any money, but they're not spending very much. As they come back to life in May, the challenge is going to be we better get customers because now we're paying people, now we're buying inventory, now we have our operating costs. The airlines were never allowed to shut down. They were required by law to continue flying. So those empty airplanes were still costing money in terms of fuel use and crew pay and all the rest of that. So one of the questions going forward is that when we have a crisis like this, do we need to change how we deal with certain industries? The airlines are on the hook now, probably for around $30 billion worth of bailout money because they've had to maintain their operations and money just is hemorrhaging out of that sector. Hardest hit states have been those that have the largest share of employment in retail, leisure, and hospitality. Surprise, that included Nevada and Florida. Kind of a surprise that Montana was in that category. Who knew that they were that dependent on leisure and hospitality? Tourism in general, been a disaster. Timing may be a benefit because if we do get a rebound in May, then we've got the entire summer for travel to make a rebound. This is the time of year when people would traditionally take vacations. We'll see. Gas prices are certainly going to be encouraging, at least for now. But be aware that one of the things that made gas pricing so cheap was that demand collapsed. So the oil companies weren't making any more production decisions. There was no need to. Nobody was buying it, and storage was full, and production has virtually come to a halt. When the demand returns, and we're assuming that it will in the course of the summer, that production will start up again, and the oil will not be cheap. It's very likely that by the time we get to fall, we're going to be looking at oil prices that are $125 a barrel, not $25. Oil is obviously a tremendously important sector for the ASA. It's hard to predict when this is actually going to come into being, but the projections are that by third quarter, we're going to see per barrel prices regularly over $100. There's almost no way that it can't go up because the production decline is so severe and so steep right now. I mean, the whole issue these days is where do you put the oil that you've already produced? Every tanker is basically being used as storage now rather than transportation. The return is going to be determined by how much consumers are deciding to travel again. Are people going to be commuting again? Is there going to be the usual transportation demand, both by the airlines, by trucking companies, by private cars? but it's also going to be how much industrial activity returns. The oil sector has been hammered hard. It is one of the sectors that's been hit probably hardest of all outside of tourism and travel itself. And expectation is that a lot of the damage will be permanent. There'll be a lot of smaller companies up in the Dakotas and Texas that don't rebound. And if they don't, it's going to leave a hole in the ocean. You've seen countries all over the world shut down operations. The Russians, the Saudis, Nigerians, they've all had to respond to this. If you look at what's happening with, again, my slides aren't working. Here we go. Whoops, don't want to skip that one. There's been a surge in remote work. We don't know how much of this is permanent. Will people continue to want to work from home? Early on, there was tremendous enthusiasm for working at home. Everybody thought it was a great idea, like, yay, I get to work from home. About 2 or 3 weeks into this, all of a sudden people are like, God, I hate this. You know, I'm tired of dealing with my children. I'm tired of dealing with my spouse. I'm tired of staring at the wall. I want to see my work friends. I want to go to Starbucks. I am just sick of this. And all of a sudden people are rebelling, saying, when can I go back to the office? I think we'll end up with some kind of a balance. There will be some of the opportunities that remain for people to work at home, but there'll also be an opportunity to go back to work for no other reason that businesses are finding it hard to manage and supervise people remotely. It's also hard to deal with team building remotely. One of the challenges is that when people are working at home, you better know what your job is, and you better know how to do it. If you need supervisory help, if you need your colleagues' help, that's hard to get. That's hard to get on a call. It's hard to get when you don't have the opportunity to walk down the hall and talk to somebody about the issue you're dealing with. You know, all of a sudden it's very cumbersome. And I've been hearing a lot of people complaining that, you know, Zoom meetings don't replace face-to-face meetings. Salespeople don't like it, and a lot of production people don't like it. So we'll see how that evolves going forward, but I don't think it's quite ready to take over the world. So kind of finishing up with kind of a reiteration of what we talked about before, should we be expecting a rebound? Most of the economists are still thinking a May rebound. We get a May rebound, we end up in pretty good shape by the end of the year. Even if it doesn't come until the summer, the decline is more severe, but you still end up at a fairly decent place by the end of the year. The big question is whether or not we get a fall resurgence of COVID. There are those who are assuming that if we get a resurgence, that we would respond similarly to what we did the first time, that we would shut things down. I think that is highly unlikely. The damage that was done by the first shutdown was more than anyone anticipated, and to do it again would be devastating. The economy would really tilt into a position that it would not recover from. And realistically, by fall, some of the options that were not options this time will probably be in place. We will have better testing by the fall. We will have better treatment by the fall. We will have better opportunities to trace where the COVID-19 virus is by the fall. We might even go closer to vaccines. The Germans are convinced that they're within 3 or 4 months of a vaccine. They're in human trials now. There are treatment options that are now at least reducing the fatality rate. And the polls, again, indicate that people will tolerate getting sick. They will tolerate getting really sick. They will tolerate being in a hospital. What they don't want to tolerate is death. So once the fatality rate is under control, then you can start talking a serious trade-off. People will say, look, if the trade-off to get the economy going is that people get really ill, that I get really ill, okay, I can deal with that. I can, I won't like it, but hey, as long as I'm not going to die from this, I can tolerate being inconvenienced and even severely inconvenienced. Reuters has done a poll of economists and discovered that the vast majority of them, of the 45 they talked to, are expecting either a U or a V-shaped recession. We're probably a little late for a pure V. We've already been in recession now for a month, but a U is basically a modified V, where you're down for a little bit of time, and you come rocketing back. There aren't a lot of them who are predicting the kind of checkmark recession that we got after 2008. That's the most vicious of all the recessions because it takes forever to come back. U's and V's see a recovery pretty quickly. And this is what you're seeing from the companies that kind of have to put their money where their mouth is. Goldman Sachs, JP Morgan, Morgan Stanley, Wells Fargo, they all are anticipating a horrible first quarter, which we got. They were all essentially assuming that quarter two is going to be even worse, and that remains to be seen, but it certainly is set up that way. I mean, January, February, March, second quarter is going to include April, and April was a devastating month. But all of them are expecting recovery by fourth quarter, and all but Wells Fargo think it's going to happen in third quarter. So they're all looking at a V, and they're making billions and billions dollar decisions based on those assumptions. Even the public is of the opinion that we're heading for a U. So not that they have any special insight, but for the most part, people are expecting a reasonably quick recovery, and that's important from the standpoint of what consumer actually decides they want to do. So life has altered. This is somebody's dog walking himself since he can't get coronavirus. I have made all sorts of bizarre observations from my office home. One of them is that when the call for social isolation began, I suddenly realized who lived in my neighborhood. Up until this point, I never saw anybody. Now, all of a sudden, they're all walking. So we were more isolated before this than after. And I've also seen an awful lot of truly exhausted dogs who are just very tired of being taken out for walks every 5 minutes because their humans are bored. I think at this point we're going to open up to questions. There may be some. And if you have questions that you want to ask later, feel free to send me an email. We have a thank you slide or two to go through, and then we'll come back to some of the question and answers.
Thank you, Chris, again, for conducting a very informative webinar, and you will be conducting another one for us on May 13th. Our apologies to the attendees for the slightly late start and the slides acting funny. Again, as you mentioned, challenges of working remotely, Also, before we end, I would like to thank our 2020 supplier partners who are truly dedicated to the positive development of the PHCP and industrial mechanical PVF industry through ASA. When making key decisions in your business, please consider these corporate partners that go above and beyond with their support to advance the association's efforts, programs, and services through advocacy, education, networking, and business intelligence. We will now be taking questions. Please post your questions in the question box. And as always, I will be sending out a brief satisfaction survey to all the attendees. Please fill it out. Your feedback is valuable. I'm just going to be waiting for questions now.
Very good.
Yes. So, Chris, tell me, you're talking about a V-shaped recovery again. Well, that's what most of the economists are pointing to, right?
It's either a V or a U, a fairly shallow U. The difference is usually just timing. If we get a fairly robust recovery in early May, I think it'll be qualified as a V-shaped recovery. But more likely, it's going to be the latter part of May, even into June, that we begin to see real response. Part of it is just a decision on the part of the states as to how they're going to open and in what phases they're going to open. Some are going to be more aggressive about it than others. And then the other concern is whether or not the consumer believes that things are safe. And one of the challenges has been trying to sort through all all the information. The Germans, for example, have shown a more unified approach to paying attention to the government. And part of that is, as the Germans have pointed out, well, our leader has credibility with us because she was a scientist for 25 years before she became a politician. So when Angela Merkel talks, we're like, oh, well, she should know. Countries like Italy, countries like India, countries like, even China to a degree, the public didn't really know if they should believe them. We have challenges in the U.S. because we have so many different people talking about it. In the course of the day, it's like, well, the president says something, and then somebody in the administration who's not the president says something, and then someone from the CDC says something. We don't really know who we're supposed to listen to, and that kind of slows acceptance a little bit.
Talking about opening up states, our Illinois Governor Chris Kuehl, had extended the stay-home order from May 1st to May 31st or May 30th, and he actually got a restraining order from a judge for that. So there are some lawsuits even against governors because they said they're extending their their authority.
Right, and I think it also is Illinois is a classic example of kind of a two-tier state, because you're going to have a lot of concern about what happens in Chicago because of the population, but the other parts of Illinois are like, well, why us? We're fine out here in Springfield and Carbondale and all this sort of stuff. So why are we? Missouri's having the same issue because on one side of the state is St. Louis, which is having more issues than Kansas City. And so what do you decide in the case of the split city? And the rest of the state, the rural part of the state, it's like, what are you talking about? We don't even have it out here.
Exactly. Anyways, we have a couple of questions. The first one is, Singapore had a great game plan for initial attack of COVID-19, reopened, and is now on lockdown again for the next month. How real could that be for the USA?
Yeah, that's one of the countries that's being watched very carefully because Singapore became victimized in a way by the fact that people came home to Singapore after you had gotten the virus under control. Singapore had a real easy time of it in the beginning because it's a small city state and was in a position to kind of control the population very quickly. But the other problem Singapore had is that a very large percentage of its population works outside Singapore. And when things began to get tough in other parts of the world, they all came home. And it was difficult for Singapore, even though they tried, to kind of monitor who was coming into the country. The testing just wasn't up to it. And it goes back to that circumstance where half the people that get it don't know they have it. So as far as the testing was concerned, they were clean. Then they get into the country and it's like, oops, turns out that test isn't as reliable as it needs to be. Countries that have been more kind of homogeneous and its population has not migrated out tremendously. That's one of the reasons Iceland is in the position it's in. People that live in Iceland stay in Iceland. It's kind of like there weren't a lot of people going, well, I'm gonna go, spend my vacation in Reykjavik. It's like, and it's been easier, and that's why in certain parts of the country in the U.S. there hasn't been a spread because, well, people in that part of the state or that part of the country don't go anywhere, and they've not been exposed, and they didn't bring it back. Meanwhile, if you live in New York or LA or San Francisco or Miami, you're exposed to a lot of people.
Right. Okay. Another one is, do you agree with Howard Schultz assessment? By Labor Day, we will see small businesses that reopened in May and June closing because their revenues never returned to pre-closing levels?
Yeah, some will definitely be in trouble because even going into this, you were looking at companies that were in trouble. And one of the challenges is going to be trying to figure out what you can attribute to COVID-19 and what you can attribute to generally the state of the economy prior to COVID-19. I mean, another good example was a lot of the conversation around JCPenney and the breathless announcements were COVID-19 has shut down JCPenney. JCPenney has been on death's door for 3 years. I mean, they have been going bankrupt for a long time. I work with credit managers. Credit managers were basically saying, we don't do any business with Penny unless it's cash on delivery. I mean, they're in big trouble. So if Penny's is going out of business for COVID-19, no, you are going out of business anyway. A lot of small businesses were in trouble before, and this just pushed them over the edge. I think that you'll see a lot of sectors where the business will come back, but often in different hands, like with restaurants. A lot of the existing restaurants will have gone out of business, but the market will still have a need for those restaurants, and they will reappear under different ownership, different organization. It's going to be tough for companies that really miss an opportunity. If you're in the entertainment business, you can't go back and recapture a concert that was missed. The sporting events are going to be affected, but manufacturers, not so much.
Right. Okay, we have quite a few more. I have heard of fuel prices being under 80 cents a gallon in some markets, while it remains $1.50 range in mine. Why is there such a large difference in fuel prices by region?
Yeah, a lot of that goes back to the whole oil distribution system that we've had for years. The prices are going to be determined by what refinery they're from, whether or not there have been special characteristics of that particular gasoline. Like we all know, the gasoline in California is more expensive because it requires more additives to be consistent with California's air pollution rules. You've got transportation costs. The oil that is coming to the East Coast is primarily coming from the Middle East because the pipelines don't really exist to bring the oil from the middle of the country to the New Jersey refineries. So the fact that the oil sector is fragmented is often what leads to these huge differences. You've got some oil companies that had lots of oil in storage, some didn't. Some are taking advantage of the spot prices, some haven't. And you end up with this variability, particularly when there's some kind of event that has changed the world price of oil. So we've always seen lots of variability, and it's going to be really obvious for the next 2 or 3 months.
Right. Well, another one is asking us, to pull the investment company slide again. I guess I can answer that. After the May 13th webinar, we'll actually be posting the presentations onto our website under My ASA. So if you have an ASA login, it's going to help you get to the presentation slides, and that's one way you can get all the previous slides that you want to look at. Okay, another question is, do you think another round of stimulus from Congress will happen? What might it entail of aid?
I don't think you'll see another big offering Congress, partly because they're now becoming more and more worried about that deficit issue. But they're not real sure that it would do much to help at this stage. Part of the challenge with the existing programs is that they're all dependent on consumer activity. They were very standard responses to a recession. Whenever you get a recession, you try to pump money into the economy with the assumption that consumers are going to go out and sit and revitalize the economy. Now there's going to be an expectation that the money that has been already allocated will finally start to make its way into the economy. Remember that slide that indicated that people were saving a lot of their money? That's how a lot of people have responded to that money that's been coming from the government one way or the other. They're saving it. And once they're in a position to start spending it again, then you'll see a bit more response. And so the government's going to wait, certainly, until they see what that initial wave does. And if there doesn't seem to be enough activity, maybe they would think about more stimulus a little later in the summer. it would be more along the line of taxes and reducing taxes or giving tax breaks, particularly to companies, to sort of help them get through the next few months.
Got it. Okay, another one is, the world changed after 9/11. How do you see the world changing going forward?
Yeah, that's a real good question, because this really is another 9/11 moment. With 9/11, we suddenly became more security conscious, and the TSA was born and all the rest of that. We're going to see a lot of health-oriented protocols entering into our daily life. We're going to see the possibility of people having temper checks and health checks before they're allowed on an airplane. We're going to see controls in terms of letting people into certain buildings. We're going to, at least in the short term, we're going to see more social distancing. We may have seen the end of the handshake, for crying out loud. But I think we're definitely going to see attempts at being a lot more cognizant of health issues, more orientation towards sanitation. Some of it is going to be personal behavior, but there's also just going to be a bigger emphasis on places being, like I watch the grocery stores now, which have been open for a while. The last 2-3 that I've been in, they've had a designated person standing at the front of the store wiping down all the shopping carts. So it's just obviously their automatic job now is that I'm going to wipe down these carts. Well, even without COVID-19, that's probably a pretty good idea. People don't want to get the flu or the cold either. So, there's going to be a lot of attention to, well, gee, maybe we should always have been paying more attention to this stuff. And now we have more reason than ever.
Right. What do you see for domestic auto demand?
I think that will probably come back, because the auto sector was doing okay and was not really in a position to have to shut down, but the unions were not in favor of having their workers going to work during the COVID-19 shutdowns. And so a lot of the auto sector, they were planning to stay open, but it was like, nope, you need to down. The consumer continues to want to be interested in vehicles, and interestingly enough, one of the, again, it's not a terribly scientific poll, but people asked, what are you doing for entertainment now that you can't go out and go to concerts and things? Driving. People are just like, I'm just going in my car because it's my car, and I wipe it down, and I can drive around, and then all of a sudden that leads to, and I need a nicer car if I'm going to be driving around for entertainment. So we may see more purchasing.
Right. Will there be another round of stimulus? And I think you answered that before.
Right. Probably not, but it would be likely more on a tax level.
Okay. Can you explain the $100 barrel oil in Q3?
Yeah. Predominantly, it's assuming two things. One, it's assuming that we start to see demand recover. So if you are hitting to the summer, you're getting into third quarter, people are driving again, airlines are flying people again, demand goes back up, and that gives an impetus for oil prices. It also assumes that the producers have largely shut down over the last couple of months, and that it will take some time for them to ramp back up. They have taken the expense of shutting down operations. It also assumes that some of the oil producers don't make it and actually exit the market. Beyond all that, you just simply have the fact when demand comes back suddenly, there's going to be a lot of producers who are saying, well, this is my big chance to catch up a little bit and make some money. So I'm going to up the price until it will squeak. And we know from past experience, oil is an inelastic good. We are going to buy. If we need it, we buy it. It doesn't really matter what the actual cost is. Even now, you look at how inexpensive oil is and how inexpensive gas is. Has our consumption increased? No. It's not like people are saying, wow, gas is $1 a gallon. I'm just going to drive pointlessly to the Canadian border. No.
Right.
You are going to drive where you drive. Back when it was getting up on $5 a gallon, people still drove. They had to go to school, they had to go to work, they had to go shopping, and they complained about it bitterly, but they paid for it.
Right. Okay. How do you see trade relations with China moving forward? More manufacturing coming back to the U.S.?
Yeah, they probably will be a lot more diversification of supply chains, and some of that will affect the U.S. Some business will start to come back. You'll also more diversification, period. More business going to Vietnam and India and Brazil and Mexico and any place else. China's big advantage for years was not really their production costs, it was their infrastructure. The fact that their total landed cost was low. Other countries are catching up when it comes to infrastructure, and now that China is becoming increasingly difficult to work with, you had the trade war last year and the year before. Now you've got this issue. Last year, China was dealing with swine flu. Not only were the COVID-19 issue, but they had that. So I think a lot of businesses will continue to do some work with China, but they're going to have more options. They're going to also be in other countries, and they'll start to bring stuff back to the U.S., particularly if they can do it without doing a lot on hiring. The disadvantage the U.S. continues to have is labor costs are higher than they are in many of these countries. But if you end up using more technology and robotics in the U.S., then the U.S. is more competitive.
Right. We have quite a few questions. Let me know when you get tired from talking, Chris.
Hey, no problem. Anytime. And again, if people want to ask questions later and want a more detailed response, emails are great. You can send them to me and I'll take it from there.
Yeah, I will actually maybe because I'm just going to read out 4 more questions. There are a few more left, and I will email them to you. Is that okay?
That'd be great.
Okay. So the last 2 questions that I'll be reading out are: can our economy easily absorb the flood of dollars into our economy by the Fed, and what are the odds it will lead to substantial inflation?
Yeah, that's a big question. We probably won't see a lot of inflation until we start to see the commodity costs and wage costs going up. So if we end up with $100 barrel oil in the third quarter, if we start to see the labor shortage show up again, which at the moment we're not, with 25 million people out of work, that's going to push inflation. The money that's been dumped into the economy by the Fed has mostly been absorbed by the Fed. The Fed is the one that's buying up the bonds that are being issued by the government. It's basically trying to push money into the business community through the banks. It is not yet a tremendously inflationary push, but it could be, particularly if the economy really begins to fire up, and there's the possibility that will happen. The International Monetary Fund is still predicting that by 2021, we are going to see a boom that is about twice what they had expected to see back in 2019. They were predicting 3% growth in 2019 for 2021. Now they are predicting 6% growth in 2021.
Nice. That's good news. All right. Lots of real estate development projects are being scaled back, especially hotel construction. Do you expect a lot of real estate failures?
I think you'll see a lot of the construction resume. The hotels and the like, of course, aren't doing anything now because they're shut down. The area that's got a lot of concern is probably office building, because we're not yet sure if this remote work thing is going to catch on. If that really does become an issue, it begins to cut into the large office demand from accountants and lawyers and people that have traditionally filled up the offices. On the other hand, you have seen a tremendous increase in care-related construction, and that's only going to accelerate because people now are becoming acutely aware of all the different medical issues that are out there, and there's going to be more money put into public sector healthcare. You're seeing that conversation starting in Congress now because we simply can't go through this again, so we better be prepared for the next onslaught. We don't know if it's going to be the return of COVID-19 or, some brand new virus that we have, the zombie apocalypse. We better be ready for whatever comes down the pike, and that suddenly begins to throw us. The Germans, for example, spent heavily on public sector to the point that they were talking about closing hospitals last year because they thought they were spending too much money on it. Now, all of a sudden, the Germans are like, boy, that was a smart thing for us to do. So everybody else is like, maybe we should overbuild too.
Yeah, I know, right? Okay, what are your thoughts on the effects long-term banking industry, considering the massive amounts of mortgage defaults? Will we see a second financial crisis as a result?
Yeah, so far we're not seeing the real default rate that we got in 2008, 2009. That's part of what made that such a horrible recession. This time around, where the banks are like, yeah, we're a little worried, but not overly, because we think that the majority of the people who are struggling right now won't be in another month or two when they get their jobs. This is feeling a lot more like kind of a 1980s style short, sharp recession. So I don't think we've got the same threat. The banks aren't as exposed as they were in 2008. A lot of the problem back then, as we all remember, is that the subprimes and the fact that banks had been loaning to people who had really no business even trying to buy a house. That is kind of no longer happening. Banks have been a lot more cautious with mortgages. Majority of the people who are currently behind and seeing issues will catch up, assuming that they get their jobs back, and the majority of them will. All right, I think I may have lost. Here we go.
Do you think there will be a need requirement, i.e. sales drop, to qualify for PPE funds forgiveness?
It's going to sort of be a judgment call. From what I've heard, that was a fairly vague part of the legislation, and there's already some rethinking as to who does and who does not qualify. Some of the publicly traded companies are being pressured to not apply or to even give some of the money that they've received. So there's a lot of interpretation going on. I don't know that anyone has a real good answer for that right now because it's been overwhelmed and a lot of the questions weren't anticipated. And now all of a sudden it's like, I don't know how we're going to handle that. So it's sort of typical. We remember back when we were dealing with the other recession that the joke was that Chris passes something so that then they can understand it. So first to pass the bill, and it's like, oh, that's what happens. I had no idea. So.
All right. Well, Chris, I actually just forwarded you the last few questions. You can send the responses to me, and I will send out the responses to the attendees. And I would like to thank everyone for attending the webinar. Again, apologies for the late start as well as the slides not moving at the right time. And please look out for info for the next webinar in the coming week, most likely end of next week. And please also fill out the survey. Thank you so much, Chris, for doing this for us. I really appreciate all that you're doing. And, you give us hope every time. I swear you do.
Well, hopefully by the time we do the May 13th ones, it'll be, we can start the session with Happy Day here again. And, we can always hope.
I know, right? I am. COVID in the rear view. Yes, I hope so.
Thanks.
All right. Thank you. Thank you so much, Chris.